Hello everyone, today we are learning about patient teaching. Now, introduction of the patient teaching. Teaching is a major aspect of Gnosis professional role. Patients are becoming partners with healthcare professional and learning self-management skills. So, patient teaching is a crucial aspect of a Gnosis practice. So, this is the teaching for the patients, and this one is the crucial aspect for the nursing practice because it is very important in the nursing profession. Now, what are the purpose of the patient teaching? First is the increase the confidence of and competences of the patient. How we can increase the confidence of the patient and competencies of the patient by we are giving the some kind of knowledge about this or some kind of questioning asking by us. Then prepare patient for independence and set an opportunity. So nurses can prepare the patient for the independency and some kind of opportunity like gain some good knowledge about the disease condition or problem solving. Increase the adherence to treatment plan and effectively reduce the incidence and complication of the disease. So by this we can increase the treatment planning and also reduces the rating of the complication of the disease, ensure continuity of care and ultimately improve the quality of care. So ultimately we are doing the good quality of care, and by this patient teaching we are decreasing the level of the disease condition, or we can say sign and symptoms of some kind of disease condition. Now, next is the importance of the patient teaching. Now, what are the importance? Increase the patient ability to cope with the health problem. So, we can increase the patient's ability for what? For the health problem, cope with the health problem. How patient are deal with the any type of sign and symptoms or disease, and empowering patient to take decision. If any kind of decision are making by the patient or relative, that we can empower them by giving the good kind of knowledge. Then increase patient potential to follow healthcare plan and help patient to learn healthier behavior. So we are going to help patient for the learn the healthier behavior and also increase the patient potential. Then improve the functioning and decrease the treatment complication. So we are going to improve the functioning of the treatment and also decrease the treatment complication. Whatever complication are going there, we are going to decrease by this kind of patient teaching. Then increase the patient confidence in self-care. We are also increase the confidence of the patient in self-care, or easily they can good care by the maybe relatives or by self. Now, process of the patient teaching. Now, what is the process are going for the patient teaching? First is the assessing the learning need. Okay, by assessing the learning need, we are going to assess the patient's learning need. Whatever needs are there, according to that we are going to plan something. Then developing a learning object. After going to assessing the learning process or learning needs, we are going to develop the learning objectives. Then after planning the after developing the objectives, planning and implementing teaching. Whatever plan are going there, and also we are going to implement that. After this, evaluating the patient learning. We are going to evaluate the patient learning because we also give good kind of knowledge. And last is the documenting the patient teaching and learning. Whatever are going to teach to the patient, that will be document in the patient teaching and learning. Now we are going to describe all these steps in detail. First one is the assessing learning needs. Assessing the patient in learning need, learning style and readiness of the patient. We are going to assess the patient's learning need by the maybe questioning, or maybe the find out the sign and symptoms of the patient, or also find out by the communication. Then being the process by interviewing the patient and assessing the learning need of the patient. also Gnosis can do the interview of the patient, because whenever going to ask the question to the patient, he or she can give the answer for whatever you want to share. Find out the patient learning style, then making the teaching strategy according to the patient learning style. So nurses can find out the patient learning style and how she can plan the teaching for the patient. She also find what language she have to use, and also what kind of style she have to prepare for the patient teaching. So first step is the assessing the learning needs. Then next one is the developing a learning objective. After assessing the problem, or we can say after assessing the need of the patient teaching, she can develop the learning objectives. It is the second step. This is the second step of the patient teaching process. To develop the objective, nurse need to define the outcome expected from teaching learning process. So in these second step, nurses can find or define the outcome, whatever outcome is expected from these teaching learning process. The learning objective are specific, attainable, measurable and short term. So she have to mention these objectives, like specifically any topic are given in these teaching, then attainable, it will be measurable and it will be short term, and easily explainable and also easily understandable by the patient. Then another step is planning and implementing teaching. Now after the second stage, she have to plan and plan the teaching, and after planning this, she have to implement the teaching. So in this step, teaching plan should be include what will be taught to the patient, then when teaching will occur, where it is, who will teach and how teaching will occur. So these all are the teaching plan should include it. These all points are included in teaching plan. What will be taught to the patient? Assessing the patient, she have to understand what topic should selected and what topic should taught to the patient. Then when this is planned or when teaching will occur, that she have to plan. Then where teaching is occur or teaching will be occur. Then after who will teach, she have to planning for who will going to teach the patient, like maybe student nurse are there, staff nurses are there, or also maybe some doctors are there. Then how teaching will occur, means how it is going, that also she have to plan. The planning of the teaching should be based on length of hospital stay, health visit available. So these planning are depend upon the hospital staying of the patient and also the health visit availables of the health visit are available. According to these 2 points, she have to plan the teaching process. Then implementation of the teaching will be based on the patient level of knowledge and understanding. Now whatever plan is going there, after planning she will implement these steps, and in these steps she have to understand the patient level of knowledge and understanding level. Always keep teaching sessions short, generally 20 to 30 minutes. While teaching, the comfort and privacy of the patient should be considered. Whenever she plan this teaching and whenever she implement this, she have to planning session according to the patient's condition. Maybe it is short, generally it is 20 to 30 minutes, and while teaching that time she have to check that patient is comfortable and privacy should be maintained. Whatever setting is used by nurse, try to limit the distraction and interruption. Whenever she going to implement these steps, that time she have to check whether some kind of distraction are there or interruption are there. That time it should be limits by her. Now another step is evaluating teaching and learning. Evaluating is the last phase of the teaching process. This is the last step of the teaching process. It is ongoing analysis and appraisal of the patient learning progress after teaching, and the learning of the patient is evaluated by observing demonstration, restatement of the instruction. So how we are going to evaluate these teaching? So in that, whatever patient are going to learn, that we are going to evaluate by the observing the demonstration. Maybe we are going to tell them to do the some kind of demonstration, then maybe some kind of restatement, or maybe some kind of objectives we can give them. By giving simple questionnaire or objective type of question, talk with the patient's family member or healthcare personnel to get their opinion regarding patient's performance and learning. So we can also give some simple questionnaire and objective type of question to the patient or patient's relative. So we can evaluate them, how he or she can understand, what knowledge are getting by them, and also we are going to ask some question to the patient's family member. Then documenting patient's teaching. Now whatever we are going to planning, implementing, and then these teaching are going to document it. In that documentation help to promote communication among with the healthcare team about the patient's progress with respect to learning. So this documentation is helping to the healthcare team members or healthcare personnel for the promoting the communication and also getting the patient's progress level. Documentation help to maintain continuity of the care and prevent duplication of work in healthcare team. Also, it is help to the maintaining the continuity of the care of the patient, and also it prevent the duplication, whether some kind of treatment are going there or we are giving already, that kind of duplication is not occur. So it is help to the healthcare team member. It acts an evidence of fulfillment of teaching and as a legal record, and also the documentation of patient teaching is done as checklist, care plan, or progress note. How we can document this? So by some kind of checklist we are prepared, or care plans are there, or some progress note are there. The document should include the objectives and goals of teaching, teaching methods used while teaching, and evaluation of what patient has learned. Now, role of nurse in patient teaching. Now, specifically role of nurses for the patient teaching process. In that, first is the identify the learning issue prior to teaching. Before planning or before teaching, we have to identify the problem or issue of the patient. The teaching aid should have simple language and illustration. So whatever AV are going to use, that will be in simple language, so patient can understand easily, and it is illustration. Teaching should be flexible and should be accommodated as per patient need. It is flexible in maybe patient is easily accommodate, should be easily, and also patients as per the patient's need. And while planning the teaching, find out patient socio-cultural and health practices. So whenever we are going to plan this teaching, that time find out the patient socio-cultural, whatever the socio-economic condition or socio-cultural they are going to follow. They have to find out by the nurses, and what kind of health practices we are going to plan, that decide by the socio-cultural of the patient. Then speak clearly and consciously. So whenever planning or whenever teaching are given to the patient, that time speak clearly and continuously or consciously. Use simple word and ask upon ended question. Whenever some kind of question asked by the nurse, that time use the simple words so patient can easily understand or patient relative can understand. Teach the patient when he or she is most ready and likely to learn. Avoid the time when patient is tired, in pain, or distracted. When nurses are going to give the teaching to the patient, that time he or she can we have to find out he or she can be ready for these kind of teaching, or also she is going to like about this, or we have to avoid in these time when patient is tired or maybe in pain or some kind of distraction are going there. Teaching should be built on what the patient already know, verify or assess the previous knowledge about the topic. Before starting the teaching, we have to find out the knowledge of the patient, or we are going to find out the previous knowledge about the topic by giving the by asking some question or verify something. Then use teaching strategy that are interactive and allow for the patient participation, emphasize on important or useful information. So we have to use the teaching strategies like it should be interactive and also allow patient to participate in the teaching. Assist the patient to learn and understand the information at his own rate and pace. Invite the patient to ask questions. If patient is going to ask some question, that time we have to allow the patient. So by this, patient should take interest in learning and understanding the topic and also gain the good knowledge about the topic. Next is the integration of the teaching in nursing process. How it will be integrated in the nursing process. There is a relationship between the nursing and teaching process. There is some kind of relationship between the nursing and teaching process. During the assessment phase, the nursing process, the nurse determines the need of effective healthcare, and nursing diagnosis is formulated based on the assessment and client situation. So how it is integrated in the nursing process? So during the assessment phase, in the nursing process, we have to find out the needs, and according to that how it is effect on the healthcare, how we are going to give the effectively healthcare, and also planning the nursing diagnosis, and how we are formulate according to the assessment of the client. We are formulate the we are going to formulate the effective healthcare. A detailed plan of case in them made based on the learning need of the client, and nursing intervention are prescribed and implemented for maintenance, health promotion and restoration of the health. And finally, the teaching process is evaluated by identify whether the learning objectives are made. So after these all these steps we are going to plan in detail, and then finally teaching process what happened, evaluate the identification of the learning object. The teaching in nursing process focus on learning need and intelligence and capability of the patient to learn. So the teaching is also find out the capability of the patient and also intelligence level of the patient, whether he or she can learn or not. Now these all steps are going to included in the nursing process. First is the nursing assessment, then after nursing diagnosis, then planning and implementation and evaluation. These all steps are going to included in the nursing process. First is the nursing assessment. By the assessment we are going to find the problem of the patient. Then after finding something or after finding the problem, we are going to we are going to find the diagnosis of the patient, and then according to that diagnosis and sign and symptom we are going to plan something. Whatever care are given to the patient, that will be planned by the nurses. After planning this, we are going to implement these plan, and at last step evaluation is done, whether it is work or not, or result is good or not. So first step is nursing assessment as a teaching process. In the nursing assessment, the effective assessment of teaching process is made on based of the following steps. First is the client's expectation. So it should be according to client expectation, then according to the learning need. If patient having some kind of knowledge, that time it should not be planned on these topic. So it on the learning basis of, or we can say need of the patient. Then motivation to learn. If patient is going to getting some kind of knowledge, that time we are going to motivate the patient. Then ability to understand. If patient are going to ask something, or we have to understand the ability of the patient, or we are going to understand the situation of the patient also. Then next is the environment in which teaching provided. Whenever we are going to give some kind of teaching, that time whether it should be a good environment, good environment or not, that also we have to check. Then last is the resources used for learning. Whatever planning should be done, or learning should be done, that is planning according to the good resources. Then next is the nursing diagnosis as a teaching process. The North American nursing diagnosis has listed two following nursing diagnoses that are formulated to interpret the data and cluster the defining characteristics based on the client specific learning needs. These specific learning needs are: first is the deficient knowledge. If patient having deficient knowledge, that we have to give the proper knowledge to the patient. Then ineffective in health maintenance, as if health maintenance are not good, that time also we are going to plan something about the teaching. Then impaired home maintenance. We are also included the home maintenance. After discharging, patient should be going to home. That time he or she can take care, self-care, how she can be included the self-care, that we have to include it. Then ineffective therapeutic regime, then ineffective community therapeutic regime, and non-compilation to the therapeutic regime, and also ineffective family therapeutic regime maintenance. So all these kind of topics we are going to include in the nursing diagnosis. Next is the planning as the teaching process. After identifying the learning need, motivation and ability to learn, the diagnosis is made based on the diagnosis and the assessment of client. So according to the learning need and also motivation and also ability to learn, the diagnosis is made. Then the nurse develop a teaching plan by determining the goal and expected outcome. The plan for teaching include the following steps. In that, first is developing learning object. First, a nurse have to develop the learning objectives. After that, developing the learning objective, identify the priority. So she have to identify the priority of the patient, or prioritize the topic. Then resources for the teaching. Whatever resources are used for the teaching, that she have to find out. Then selecting the time and environment for the teaching. She have to select the proper time for the teaching, and also environment are selected by the nurse. Then prepare content for the teaching. She have to prepare the content in proper way for the teaching. Then developing from the exciting knowledge, and also selecting appropriate method of teaching. She have to select the proper method for the teaching, so patient can understand easily and patient are going to interest in that. Then last is the formulating a plan of the teaching. Then after these all steps are going there, formulate a plan of teaching. So by using these steps, she can plan the teaching. Now after planning, implementation. Whatever is going to plan, that will be implemented by the nurse. After critically analyzing and identifying the data for teaching, or effective teacher will concentrate on the learning needs and be able to motivate the learner to understand the concept of teaching. Implementation of the teaching is done by providing information. It will be implemented for the providing the information about the topic, then obtaining feedback, then participating in counseling, and in calculating the teaching as a learning behavior. So in the implementation, 4 steps are following for the good teaching: providing the proper information to the patient and relatives, Also obtaining feedback. After giving the teaching, she have to obtain the feedback, how it is, and also he or she can understand or not. Then participating in counseling. So patient can easily participate and easily ask question to the nurses. Then inculcating the teaching as a learning behavior. Now last is the evaluation as the teaching process. The client education cannot be completed if the evaluation is not done to identify whether the learning objects are obtained. Evaluation is done by identifying whether the goal and objectives are met, whether changing in behavior identify whether the problem and barrier in the learner is overcome. So after these implementation step, we are going to evaluate this teaching process. So in evaluation, the changes obtained in behavioral of the learner must be clearly documented. Whatever behavior of the patient, that will be documented by the nurses. Now summarization of these topic. First we are going to discuss about the purpose of the patient teaching, then also importance of the patient teaching. By after that, process of the patient teaching. What is the process of the patient teaching? Then in that process, assessing the learning needs. Then after assessing, developing the learning objective. Then after developing these learning objective, we are going to planning and implementing the teaching. And after last planning and implementing, last step is the evaluating teaching and learning. And then after documenting patient teaching. Then we are discussing about the role of nurse in patient teaching, also integration of the teaching and nursing process, how it will be integrated in the nursing process. So in that, the nursing assessment, first step, then nursing diagnosis, then planning, then implementation and evaluation. So by these all steps, we are going to integrate the nursing process by the assessment, by the nursing diagnosis, by the planning and also implement, and last the evaluation. Thank you.